This has probably happened to you. You go to the doctor gives you an exam and diagnosis, then hands you a hard-to-read prescription. But as you leave, you may be unsure of how or when to take your newly prescribed medication. Well, there's a resource available to all of us that we often don't use, and they're instrumental in keeping patients safe and also saving them money. Reporter Julia Wong explains.
Oftentimes the emergency physician or your primary care physician is so busy they don't have time to really talk to you about why you're receiving this medication and what this medication actually does. What are the benefits of the medicine? What are the risks of the medicine?
Dr. Conrad is talking about how busy doctors can sometimes leave patients with unanswered questions. And that's where pharmacists should come in, but they're often underutilized.
Not very often. Once in a rare while we have a question.
Pharmacist Ahmed Atala said patients like David Lindsay are common. A 2006 survey found 50% of patients aged 65 and older waived a consultation, and that could lead to problems.
People will be taking medications they don't even know what it is for.
Pharmacists can tell patients all about the different drugs that they're taking, and they also have pamphlets on how to handle diabetes and beat the common cold and many other health conditions.
If patients would utilize the advice of a pharmacist, it can cut down on their visits to emergencies or even to a physician's office.
A lot of the times the pharmacist is the last person to recognize if there is a missed dosage or a calculation that's incorrect.
The Food and Drug Administration estimates incorrect drug use annually sends more than 4 million people to the hospital, and the National Community Pharmacists Association said pharmacists can reduce healthcare costs by more than $177 billion every year.
And if you have one more person overseeing this process, it's just an extra layer to the safety net.
Atala says more patients have come in asking for advice during the recent H1N1 scare.
We have a lot of information about a lot of different things, and people should make use of that.
And he hopes it showed them how vital pharmacists can be to their health. For Torrance City Cable 3, I'm Julia Wong.
Thanks, Julia. The process of becoming a pharmacist is almost as rigorous as becoming a doctor. After a 6-year college program, one must complete an internship under a licensed pharmacist and then pass a state exam. But it could all pay off since so many jobs are available. Currently, there are up to 10,000 unfilled pharmacy positions in the U.S.